the Medical College of Wisconsin, celebrating Hispanic Heritage Month.
I grew up actually in Spain, in Madrid, and then my dad used to work for the International Red Cross, and we traveled to different countries. So I actually can say that I did a little bit of my growing up in 6 different countries altogether. I come from 4 generations of physicians in my family, and I did the natural thing. I went to medical school in Spain, graduated early, did kind of a residency program, which is a little bit different than what you're doing here. Usually, if you're any good at medicine, they'll send you out on your own, out into some of the really small towns in the community. And it's kind of a scary, experience in a way, because you are the person that everybody goes to, and your local support is miles and miles and miles away. It wasn't really until I moved to the States after I had graduated from med school that I developed an interest in research. Because at the beginning, in all of my family was direct patient care all the time, especially with emergency services with the Red Cross. As I landed here, I came in first to interview for a different position than what I have. And while I was here, we started talking about the CTSAs and how our CTSA was very young here at this institution. And when the people that were involved in the recruiting got a hold of the fact that I was working for a CTSA before, they found it a better match for me to be working in the CTSA. And it felt right from the beginning. The culture at the Medical College of Wisconsin was right for me. One of the things that I learned a long time ago is to not have a job just to have a job. That you want to be able to have something where you're going to be able to develop a passion for it and be able to own what it is that you do. I love it here. I mean, everybody was worried about how I was going to react to the weather, and I was like, I like the cold weather actually. What I'm more concerned about is whether I fit the culture or not. And it was very refreshing to know that we have the right culture here, that while we have a lot to learn and we're learning from each other, especially culturally, but that we have the right attitude to do the right job. 12 hours in the lab are just not enough. I wasn't finding enough answers. And so I wanted to always get out and do more. So in a way, the job that I have today is one of the most fulfilling ones, because not only do I get to support all the research environment, but I have some of the abilities to actually make the right connections on other places and at all kinds of different levels to be able to enhance that experience, not only in creating opportunities for the investigators, but also making the research experience a lot more pleasant for people who participate in research. I always try and follow this little phrase, bloom where you are planted, and to be able to see the green on this side of the fence every time. But sometimes your everyday job challenges makes it, not as green as you want to. However, the environment at the Medical College of Wisconsin is really one of collaboration. But it really is the fact that they do open the door to you, and they do want to hear what it is that you have to say. And they're never too busy to give you that chance to come in and say, how is it that I can collaborate and I can be a part of the transformation of the clinical research environment here in Southeast Wisconsin. Very refreshing, very encouraging to continue to do your job, because it is very challenging. And ultimately what gets me out of bed every morning to come in and here is to know that everything we do, every new subcontract that we sign, every new collaboration that we help get together, teams of investigators that are going to solve problems, is that ultimately somebody out there in the community that is currently suffering of some condition is going to get better and is going to get some relief.